to determine if it's bulimia or anorexia nervosa. Both anorexia nervosa and bulimia nervosa are eating disorders, and they can be fairly easy to confuse with one another because of a lot of similar features. The thing about bulimia that I think makes it a little easier to figure out if it's actually bulimia or anorexia is that someone with bulimia has mostly a normal body weight, which means they maintain a normal weight and don't look overstarved in a first glance. What can happen with anorexia and bulimia is that someone can have a diagnosis of anorexia nervosa, but then their weight can move back into the normal range, where they only really have the binge eating purging cycle left, and the diagnosis may change over to bulimia. This also meant the same thing can happen with bulimia nervosa being changed over to anorexia, which means somebody could have met the diagnostic criteria for bulimia but then start showing more signs or symptoms of anorexia nervosa as they could still be held onto that binge eating purging cycle. The diagnosis would typically be anorexia nervosa binge eating purging type. Can someone be diagnosed with anorexia nervosa and bulimia nervosa at the same time? There is a lot of confusion in the diagnosis of these two conditions, and certainly, some clinicians may diagnose both at the same time, which means they may claim that we can diagnose a single person with both. They may do so because they understand the definitions to be the same. But in my humble opinion, the answer to this question is no. You can only have one diagnosis or the other at a specific time period. Because technically only one diagnosis can be in place, because the condition for the diagnosis of anorexia is that it has to be a weight level below normal, and the condition for bulimia nervosa is that it has to have a normal weight level. Both anorexia nervosa and bulimia nervosa can have very severe consequences, and they are both serious issues and should be taken seriously. But I tend to think of anorexia nervosa as a more serious and more severe eating disorder than bulimia, because it has that low weight component to it, which sometimes leads to dangerous consequences if persisted for a long period of time. But again, anorexia nervosa and bulimia nervosa are both serious mental health disorders that need proper mental health treatment and medical treatment,